you had to sign that within 72 hours you will have to be deployable. And this exercise need to be done. RDs have to be communicated that this is the serious business and this is the commitment which we are going to have. And this is the room which is full of RRT members and search team members. So all of us are sitting here. We understand that there may be some emergency with somebody who is not able to travel. And that's why this large pool of people. At any given point of time, we are expecting 1 outbreak or 2 outbreaks. So that means we will have sufficient pool from which we can, have some backups.
Thanks, Rustam. I mean, these are very important issues, and I think both, being UN organization or even umbrella organization, both organizations share these similar problems. So I'm not offering any solutions here, but one good thing is, because of these SOPs, at least we now have standard against which GPI partner organizations need to perform.
In fact, the solution is there. Huh? I mean, we know the solution. As soon as the headquarters or the regional office say that I need this person, the representative, that's why the representative have to be on board. WHO representative or UNICEF representative, it's easy for them to send you on 24 hours because they have that authority. Whereby, if it comes from the regional office or the headquarters, the administration process will be much more difficult. But if the headquarters or regional office calls the UNICEF or WHO representative, then they can send you on the spot because they have that on that authority.
We have a range of issues which are, we'll say, internal, as you've raised, in terms of the internal communication. That the SOPs are there to actually provide the guidance for that to be operationalized. Then there are issues around communication to external actors, especially government and other partners. Okay? So those are two important strands of discussion.
This presentation from European perspective. There are 53 member states in the WHO Europe, and only 22 have the WHO country offices. And not all they have UNICEF country offices. So at least half of the region would not have any support in terms of outbreak response. That means that the role of the regional office will arise and will be slightly different because of the all communication can be made from the regional office only.
I mean, it could take up to 4 months to hire a company. So I don't see anywhere in this SOP document where it says that there are some exceptional rules in terms of waiving off of some of the procedures, operational and supply procedures. It has to be somewhere there that in some cases you should be allowed to do a sole source selection where you have to quickly, for example, you have to quickly make the audience aware of the dates, campaign dates or something.
So there are some procedures for fast-tracking human resources, recruitments, and also other procedures. But it does take time, and I agree, it's a bottleneck. So it has to do with internal advocacy, and that's why we raised this question, is that do they really understand that we need to, like, how are we going to bring on board the media company in 72 hours? So that means we need to first do the mapping and see if there are any LTAs, long-term agreements, which are in place, which can be leveraged, any project cooperation agreements which can be leveraged, like what we did in Madagascar recently. There was an NGO working in that area, so we just went and had a supplemental budget and had a quick approval, and it's doable. It's just whether you have enough support at the senior level.
Can we go back to the communication slide for a second? I just wanted to point out something to help colleagues over here. If you see number 1 under C4D, it says share the C4D polio toolkit and list of long-term agreements that the country office can immediately use to accelerate the response. So this is not just for UNICEF. In the UN system, we have LTAs, we can share them with everyone. So we spent a big part of 2013, starting in 2013, going into 2014, identifying companies under 6 categories. So lots of times it's not only that you have to just look at the country resources, contact us and look into the lists that we have, but not also in our list, also in the UN system list. There are lots of companies in that already have LTAs that can help to, with the process of speeding up things.
I don't know, in countries where UNICEF actually gave this fund to the ministry, that makes life easier. For example, yes, having contract with different channels, or let's say TV or any party, it takes months and months and months. But if the request comes through the government, then that makes life easier.
First, to your point, that and which is related to your point also, it's like L3 emergency. And that's where IHR thing comes in again. IHR declared polio to be FIC, or whatever you call it, Public Health Emergency of International Concern. So IHR has explicitly declared that if there is a country which is infected, and that is where Rustam's point comes in, and that's about internal advocacy and internal communication. So that's sensitizing your regional director, your UNICEF country representatives, that this is critical.
Okay, let's move on to the next topic. Lack of clarity of roles.
Okay, for the lack of clarity of roles, we come up with a couple of actions. One of them is as the first action is the joint planning at the national level.
Joint planning, okay.
The joint planning at the national level with all the parties involved, basically, and based on the outbreak response plan as well as the SOP. It was also suggested that we can add the terms of reference of the people to the part of this joint planning meeting. I think it's very important that the leadership of this committee has to be identified, and that basically is the Ministry of Health. So they have to be in charge of the of this whole outbreak response plan. Other thing is that the TORs of the people who are involved again has to be shared within the group, and everybody knows who's doing what. It's also important to have the regular coordination meeting. It can start on the daily basis, and then it can move to the weekly meetings. And the minutes has to be shared with all the parties involved, so we know what is the action points and who needs to do what.
On to the Team A and B surge with the identification of polio focal points, both within WHO, UNICEF and the Ministry of Health, with the Ministry of Health adding identifying a team itself through their own internal mapping.
Identification of focal points within the agencies?
Within the agencies, including the Ministry of Health.
In the country?
In country. The final one was training or orientation with regular refresher trainings for long-term sustainability.
I just want to point out that I think it means the mapping of the locally available resources that are already in country. So these are other persons that can be immediately hired because they have experience already in responding to polio outbreaks in other countries, but they're not at the moment connected with either WHO or UNICEF. But they can be mobilized as soon as possible because they're already in country.
Mapping of local capacity and mobilization of local capacity. Okay, good. Brigitte?
A comment on the lack of capacity of country office teams. I think that it's important perhaps to put at this point also MOH. And when I'm seeing identification of polio focal point within our agencies, I think that at the same time we should have also focal point within the MOH. So restricting it only to our agencies, I think that it's a bit...
The idea is the country team is WHO, UNICEF and MOH.